Since this webinar is part of Patient Empowerment Network's Thrive series, I thought we could start by getting your opinion on what you think it means to thrive with AML.
Yeah, so thriving with AML, I think, can mean different things to different people. Thriving with AML can mean when you have the disease, really having the fortitude to get through the treatment that you're being given, because sometimes that can be tough and sometimes it's not easy. But the people who are thriving are the ones who are able to discuss with their doctors what their treatment is, what the side effects of that treatment might be, how to minimize those side effects, and how to get through that treatment so that not only do they feel better physically, but can feel better emotionally, and ultimately, hopefully, go into a complete remission.
Mm-hmm. Thank you for that, Dr. Stein. I think that helps guide us as we continue this conversation. Getting appropriate AML care is part of thriving. And when we consider treatment options, it's important to understand the goal of treatment. So how would you define treatment goals for patients?
Yeah, so the treatment goals for patients really come in different forms. I think, fundamentally what everyone wants is everyone wants to go into a complete remission and be cured of their disease. And certainly that's an overarching goal that we aim to achieve with our treatments. But there are other goals that I think that are important to various patient populations, depending on what stage of life they're in. Are they 85 years old or 90 years old and have lived a long, full life? And their goal might be to improve their blood count so they don't need transfusions so frequently, and they might be able to go to that grandchild or great-grandchild's wedding or other life event. There are other patients for whom the goal might be very discreetly just to get to that next step in their treatment. That next step in their treatment might be a bone marrow transplant. The next step in their treatment might be some more therapy. But I think overall, as a doctor, our goal is always to do our best to get our patients into a complete remission and cure them while maintaining the best quality of life for our patients.
What do you think is the patient's role in setting treatment goals?
Well, it's really important for the doctor to explore the goals of treatment when they first meet with the patient. I don't think doctors should assume that all patients come into that first visit with the same goals. And what those goals are, I think, may differ a little bit from patient to patient. And it's really important for the patient to express overtly what their goals are, what they want to achieve from the treatment. I have some patients that come into me and they say, my goal is to be cured and be alive for the next 30 years or 40 years or 50 years. And I have some patients that come into treatment and they say, I've had a very, very long life and I just want the best quality of life I can have for as long as I can possibly have it.